So welcome everyone. We're very excited to have you all here with us today. I'm sure all of you have come in through various ways, and some might be through the South Asian Public Health Association advertisements. Others might be through the speakers, or just you found it on social media. So we're very excited to have everyone here today. For those of you who don't know us, I'm going to go through with a quick introduction to who South Asian Public Health Association is. So the South Asian Public Health Association has been in existence for 25 years, and we focus on improving the health and well-being of South Asians in the US through research, advocacy, and health education, and a lot of collaboration with partners on the ground. We are focused on a lot of different issues that affect the South Asian community. With this year, our main focus is being around chronic diseases, mental health, and social determinants of health. And it's been expanding to talking about aging communities as well as violence in the South Asian community and how it affects us, both targeted towards us or even within. And so over the next few years, you'll be seeing us expand a lot in the activities that we do. We are joined today by some of the people on the board of directors. For those of you who don't know me, my name is Samira Khan, and I'm the president of the South Asian Public Health Association. And Pavitra Suresh, who is our comms co-chair, is also going to be moderating today. And then we have other members of the board joining us as well. We have 5 committees. So excluding the executive committee, we have a research committee, communications committee, development sustainability, event planning, professional development, and the advocacy committee. Some recent achievements and current projects at SAFA. We are celebrating the 25th year anniversary this year, 25 years of founding it. And we've had an amazing, I think, 70 or so board members that have helped to raise the spotlight of SAFA. And so we actually launched a podcast series this year where we've reached out to previous board members to talk about their career journeys, the founders of SAFA, as well as previous board members. We've also been sending out monthly newsletters to just talk about the activities of SAFA. Recently, we were involved with the Cambridge Health Alliance Climate Health Organizing Fellows Program and have developed a climate health task force. We also had a few events. We had an Our Health Town Hall back in February. We had I think 2 weeks ago, we had a fireside chat with Dr. Tun Nakasi for the Office of the Surgeon General. Our advocacy committee also presented at the API GBV Summit workshop focused on equipping organizations to aid South Asian survivors' mental health and well-being. We are also working on publishing a health disparities report, which is, I think, one of our biggest publications since the Brown paper that SAFA had released a few years ago, I think around 10 years ago. This is really just laying the land of what South Asian public health looks like and what is affecting our communities. And so we have the hopes of having that released at the end of the year. Our research committee is also in the process of developing a research repository, which we're hoping to essentially have as the South Asian PubMed equivalent. We are also in the process of developing a Caring for a South Asian Patient guide to share with other providers and patients to help advocate for the public health of South Asians. And then we also recently received funding from NCAPA for a racial equity grant, which is going to be focused on just addressing misinformation on health in the South Asian community. And we are also sub-awardees on 2 NIH grants. One of them is CARE 2.0, which is focused on getting South Asians inside a repository for research focused on aging. And then the SEAL grant is focused on diabetes and community health workers. Finally, we are going to be joined by Pavitra Suresh, who is the SAFA Communications Co-Chair and also a moderator for tonight's event. Pavitra is a Tamil Indian American social scientist and scholar with a PhD in cultural studies. Her research and professional interests focus on creating meaningful, intentional, and intersectional access and inclusion across different types of institutions. Her dissertation investigated the sociocultural determinants of poor South Asian American mental health outcomes in Research Triangle, North Carolina, remaining attentive to disparities across gender, caste, and other social markers of difference. She utilizes comprehensive qualitative methodologies, including surveying, interviewing, focus groups, and ethnography in her work. She also serves currently as the Associate Director for Assessment with the Office of Institutional Research and Assessment at Howard University, and she's also a wonderful board member for SAFA as well. I'm going to just stop sharing my screen to hand it over to Pavitra, but as a reminder, please continue to mute yourself please put any questions in the chat box, and your questions will be asked by a SAFA member at the end. Thank you. Go ahead, Pavitra.
Thank you, Samira. Hello, everyone, and welcome to Shattering Stigma, a virtual panel discussion focused on mental health and suicide awareness in the South Asian community. As Samira said, my name is Pavitra Suresh, and I'm a SAFA board member, and I'm honored to be moderating this important conversation today. As we all know, mental health is deeply stigmatized across many cultures, and this is particularly true within the South Asian community. And discussions about mental illness, therapy, suicide prevention, etc., are often avoided, which leaves many individuals and families struggling in silence. The aim of today's discussion is to confront these barriers, shed light on the unique challenges our communities face, and share strategies for creating more supportive and open conversations. We're fortunate to have a distinguished panel of experts and advocates among us, each bringing invaluable insights and experiences. So I'd like to introduce them to you all. First, we have Pooja Mehta, an outspoken South Asian mental health and suicide prevention advocate who's been a driving change in communities across the United States for the last 10 years. As a professional with direct lived experience and a suicide loss survivor, she is eager to further the dialogue around the role public health and personal perspective play in mental health care, while leading conversations that change the way we think and talk about mental health as a society. Originally from Raleigh, North Carolina, Pooja holds a Master of Public Health from Columbia and serves as the Vice President of the National Alliance on Mental Illness. She's a leading voice in the mental health advocacy space thanks to her firsthand experience, ranging from psychiatric hospitals to town halls to Capitol Hill. Next, we have Dr. Aruna Jha, an associate professor at the University of Washington Whitewater in the social work department. She's previously worked with the Veterans Administration, including as a suicide prevention coordinator. Dr. Jha has been active in suicide prevention for 30 years and is a master trainer for QPR, or Question, Persuade, and Refer, a gatekeeper training for suicide prevention. She's fluent in several languages and has lived and worked in India, Germany, and Sweden prior to migrating to the United States in 1984. This rich international experience informs Dr. Jha's approach to suicide prevention training and highlights the impact of cultural values, social factors, and mental illness on suicidal ideation and behavior. Her research focuses on acculturation and life transitions as risk factors for suicide in communities of color, with a particular focus on suicide in youth. Dr. Jha has a PhD in social work and a graduate degrees in child development, mental health counseling, and social work. She is a practicing clinician and regularly presents workshops on suicide prevention and surviving suicide loss and bereavement in clinicians. And finally, we have Dr. Suvrat Bhargave. Dr. Bhargave is a native of Atlanta and has been an active member of the Indian American community his entire life. A child and adolescent psychiatrist by profession, Dr. Bhargave has lectured nationally on a wide range of topics, including personal growth, relationship fulfillment, and effective parenting. His book, A Moment of Insight, Universal Lessons Learned from a Psychiatrist's Couch, offers practical strategies and thought-provoking narratives to not only understand and persevere through challenging dilemmas, but to see greater purpose during those times. He has served on IACI's board of directors and been the chairman of the Indian American Scholarship Fund and emceed numerous programs, including the Festival of India and the Miss India Georgia pageants over the years. Dr. Bhargave has hosted A Moment of Insight with Dr. B on Hay House Radio and is one of the longtime hosts of Music from India on WRFG 89.3 FM every Sunday from 3 to 5 p.m. He lives in Peachtree City with his lovely wife and their proud parents of two charming young adults. So throughout the discussion, we will be exploring the sociocultural factors that contribute to suicide, issues of suicide in the South Asian community. We'll break down some of the stigma surrounding these issues, and we'll highlight practical approaches to support and prevent suicide, to support people who are struggling and prevent suicide. I also want to recognize that there is always a suicide loss survivor in the audience, and the panelists and I want to acknowledge them and hold space for their experience. We encourage all attendees to engage actively and ask questions in the chat. And audience members, as you're joining today, we invite you to share with us what brought you to the event today. Thank you all for being here, and we'll go ahead and get started with our discussion. So I'd like to ask all of our panelists, beginning with Dr. Jha, what personally motivates you to engage in the work of suicide awareness and prevention? And Dr. Jha, you're muted right now.
Thanks a lot. I'll repeat myself here, Pavitra. So first of all, because we've got a nice intimate group going, I want to apply a correction. It's not the University of Washington. It's the University of Wisconsin at Whitewater. Yeah.
My apologies.
No problem, no problem. But not only have I been asked this question before, but I ponder it a whole lot, which is it's become like my mission in life. It's not just a passion for me. It's really an undying belief that every life matters, every life is worth saving. And that's what keeps me going. It's been a long, hard journey. And I guess my motivation really stems from the very first incident that I was called in to help with. I was just starting in the training. And when you talk about shattering the stigma, I want to say that I was also embodying the same stigma. So when I came back to get my doctorate and my mentor was saying, Aruna, you need to study suicide in Asian Americans because nobody is studying it. At that time, the suicidology organization was very active. So she knew what she was talking about. I remember saying to her, I will not touch it with a 9-foot pole. And she said, why? And my answer was, because my community will not let me be in peace. That was the level of stigma. But then there was a suicide, and a friend of mine contacted me to say a freshman has died, and these kids are saying, can we find somebody, anybody to help them? And I did, as a novice, the very first postvention. We call them postventions. It's like, how do you support the grieving community or individuals or families of someone that has died by suicide? And I went into this temple, a very large temple in the Chicago area, and there were 65 young people there, including the siblings of this young freshman that had died. And it was a major wake-up call for me. I was shocked. There were so many doctors in our community. I knew so many psychiatrists personally, and you had young people grieving to their parents to say, is there nobody that can come and talk to us? So that was the start of my journey. But what keeps me going now is the realization that we ourselves are setting up the barriers for us to address this very serious issue. And the issue continues to grow. It's pervasive, and it's become worse since after COVID. Okay, so we desperately need to organize at a grassroots level. And I put my weight behind that wheel, but it's a wheel that I'm trying to push up a hill. And I hope today is the start of a different new day. So thank you to Safa for doing this work.
Thank you so much, Dr. Jha. Dr. Bhargave, what about you? What personally motivates you to engage in this work?
Yeah, again, I want to say thank you to you guys as well, Safa, for organizing this. So my professional work as a child, adolescent, adult psychiatrist allows me what I consider to be the privilege of sitting with people during really challenging and difficult times. And I can say that whatever I may have done to help get through those times, the lessons that I've learned through that have been profound. So that's one thing. But even going back further, I remember being a preteen, teen, and at the time growing up here in Atlanta, born and raised here in Atlanta, there weren't very many Indians. And so we did rally around each other when things happened. And I remember an incident where we, young teenagers, were asked by our parents to go visit a family whose child had passed away. And we weren't given much more information. We weren't really told what our role was, but we went there. And I remember this mother hugging really tightly each of us children. And what I reflect on now is how awkward it felt. I wasn't sure what we were supposed to do. I wasn't sure what our role there was. And as I look back on it now and bring it up to some of my friends who grew up with me at that time, I don't think we were ever told that that young person had taken his own life, nor were we really prepared to understand what that meant for us what our role was going to be there, nor was it a way for us to then have a conversation around it. So that sticks with me. And then I think the other personal fact that I would like to share is that I myself am a survivor of childhood sexual abuse that occurred within an extended family situation here in Atlanta. And so when I talk about stigma and trying to understand what keeps someone from being able to seek help or to share, I do understand firsthand what it's like to think that you have have to shoulder the burden of respect of the family and image and all the other things, even though my family has been and always will be, I know, one of my greatest supports. So there's a lot of different things that motivate me, but I'm just excited that we're having this discussion today.
Thank you so much. And thank you for sharing that with us.
Yeah.
And then Pooja, what personally motivates you to engage in this difficult work?
Yeah, so, I just really want to thank you for the acknowledgement at the beginning of this panel because that is me. I am here because I lost my brother Raj on March 27th, 2020 to suicide. And, in the aftermath of his loss, I'm very vocal about my experiences. And for me, part of coming to terms with what had happened and growing through it was sharing a lot of my experiences on my social media channels. And from the time I started doing that to today, almost on a weekly basis, I get somebody reaching out to me about how they have gone through a similar experience. And I'm the first person they're telling about that in the last 6 months, 6 years. The record that I've seen is 3 decades where, they're just not able, like, they are not able to talk about the way that their loved one died. And then coming across the information that I was sharing about my experience was the first time they were ever seeing someone who looks like them talking about this kind of loss. I don't know. I like genuinely don't know if I would still be alive today if I hadn't been able to talk about what I was going through and what I was feeling and ask for that help. And so what's motivating me to be here and what I'm so grateful for Safa for creating the space for is being able to talk about it so that the people who need to talk about it can feel safe doing so. You can't heal if you can't acknowledge, and you can't acknowledge if your community, if your household is preventing you from doing so.
Thank you so much, Pooja. You bring up a really important point, which is that there is a lot of silence around this topic in the South Asian community. And so I want to direct this question really to Dr. Jha, which is, what have you been noticing in terms of the prevalence of suicide in the South Asian community compared to the majority population, but also to other immigrant groups?
Thanks, Pavitra. So in order to contextualize my response a little bit, I want to alert everybody that the source of data for all of us, for all health conditions, is the Centers for Disease Control. And so the perception really is that we are a low-risk community for suicide deaths. And so if you look at CDC data sites, it shows Asian Americans have the lowest. But the fact that we are aggregated amongst all Asian groups is just one part of the problem. The second part of the problem really is that the data is not accurate. In the community, there is an assumption that the data is solid and we can just trust that. But what we all know and what Safa knows now in tracking anecdotes of suicide is that it's happening a lot. So I was intrigued by that, and that's what my research has been most recently. We were testing the hypothesis of, is there an element of racial misclassification? So we're not faulting anybody. We're just saying this is something that needs to be corrected. So I looked at data from DuPage County, Illinois, which has a high representation of South Asians. And sure enough, our hypothesis was correct. There was more than a 55% error in the racial classification of South Asians, and the majority of them were being classified as white. When we corrected for race based on the last names of the decedents, we found that South Asians had the highest rates of suicide. I want to repeat this. The perception is that suicide is predominantly a white male phenomenon. And our data from one county has shown that South Asians are even higher than white males. So it is a very, very serious problem. If people are interested, they can pull up my manuscripts and study that a little bit more, just in the interest of time.
Thank you so much, Dr. Jha. I mean, this obviously is a very shocking statistic to mention. So I'm wondering, Pooja, you do a lot of work on the ground and you've done a lot of policy work as well. Can you tell us a little bit about some of the unique factors and challenges that the South Asian communities or South Asian communities might face regarding suicide awareness and prevention, considering this high rate of suicide?
Absolutely. I think I'm really glad that this conversation is being categorized as suicide awareness, right? Because you can't talk about prevention until you are aware both within and like within the community and then external to the community that this is a problem. And I think, it kind of goes back to the point that I brought up in my motivation to this work that, you know, I don't know for those families, Dr. Jha, that you went and like recorrected the data for. I don't know if the families were talking about how their loved one died. I don't know if the families were like telling other members of their community that this had happened to them. And so, and I think they probably weren't. So what that does, it creates this perception even within the community that this isn't something that happens to us, right? And then just kind of further stigmatizes when it does happen, which it does happen, further stigmatizes within the family that, oh my gosh, this has never happened in our community before. And now my loved one is the first one to do this. How could that be when that's never been the case? It's been happening all along. We've just been selectively choosing to ignore it, selectively choosing to not pay attention to it. And a lot of it is because of the backlash that we face when we talk about what happened, how it's something that we did wrong, something that our parents did wrong, something that the family did wrong, or that child or that person was just, a miscreant and better off without them.
And Dr. Jha, do you have something else that you wanted to add on to that?
Yes, I do. So, Pooja, my answer is for you, but also for everybody else that's listening. Over 30 years of trying to make a dent, what I've learned most of all is that we do need to be compassionate towards our community as well. I think people believe that they're being kind when they resort to silence. Many times people don't know what to say in the aftermath of a suicide. But what I've learned, not only from our community, but from working with suicide loss survivors across the board, is something that we can incorporate so easily into our community's responses. When people are hurting that bad, they don't want to be abandoned by their friends, which is how they experience it when people withdraw in silence. Please reach out. Remember the birthdays, remember the anniversaries, remember who that person was. Because if you ignore the death, you've also ignored the life of that individual and all that individual contributed to the lives of the families that are grieving. There is no grief more traumatic than a suicide loss grief. It is, and it's well written about. It is a very complex, traumatic form of grief. So I can understand that our community is not acclimatized, to the American way of responding, but we are a teachable community. We can learn to be different. And it's not about feeling sorry for someone. It's actually being a compassionate human being. Just go give them a hug, take them some food, say, I'm thinking of your son, your daughter, your husband, your wife. But we have to get past our own conditioning about what is the correct way to respond. Because we are a culture that really worries about image. And it's not just in the US, it's something that we carry from our heritage from India. So worried about how we come across to others. Yeah.
That's a wonderful point, Dr. Jha. You know, that sort of loka kienge. What will people think, right? We worry
Right.
so much about that. And that brings me really to my next question. So we've thought a lot about like the traumatic and immense grief that comes with suicide loss and the loneliness that can come with it if, the community can't support you. But I think also we need to talk a little bit about those who are suffering from suicidal ideation, who are resistant to seek help. So, Dr. Bhargave, let me ask you, how do you think cultural beliefs and stigma and social shame impact perceptions of suicide and help-seeking behaviors? And you're muted, Dr. Bhargave.
My cat was at the door, so I had to mute myself for a second. Yeah, I mean, stigma is actually one of the biggest barriers to suicide awareness, suicide prevention. We know that the studies have shown us that. And not only is it a barrier, it's a barrier that's immediate and it's a barrier that is really profound. What we do know is culture, our culture often teaches us how to deal with distress. It teaches us who we should rely on when we're going through challenging times. And a lot of times those beliefs then present themselves with who we might want to present ourselves to. Do we even seek treatment at all? What we do know is that members of minority and ethnic and racial minority groups seek treatment less than our Caucasian community. And again, a lot of times it goes back to culture. There are members of certain ethnic groups, including South Asians, who think that when they should seek help, maybe talking to their primary physicians, maybe talking to a family member, but again, they may not get the help directly from a mental health professional. And again, some just don't seek treatment at all. And when it comes to cultural biases, there are many notions that are ingrained into our culture that oftentimes keep us from seeking treatment. One is one that we just alluded to, which is that in some way, if we seek treatment, we bring dishonor, we bring shame to our family, right? That idea of what will people say and what will people think. Along with that, I think here, and as we talk about South Asians in America, there is this pressure to be perfect, this perfect modeled minority group that somehow is accomplished professionally, socially within our communities, and seeking help would in some way chip against that. And then I'll also throw one more cultural belief out there that comes up a good bit in my work with South Asians, and that is the idea that the generations before us have had trauma that is in some way more significant. And so in that way, their own trauma is less relevant, less worth seeking treatment for. So all that to say, stigma is a big factor. Cultural beliefs are a big factor. Not only does stigma, again, reduce a patient's potential perceived need for help, but how well they adhere to treatment. It also increases isolation and it really decreases self-esteem. So it's a big factor.
Thank you. So in what you're saying, it really sounds like this is a community that has a lot of generational closeness, where families are very closely knit, when there's a lot of consideration of what someone's parents might think or what their ancestors might think. So my next question really is, I think for Pooja, who has done a lot of this work in her advocacy, what do you see as the role of families in this effort? How do families impact the process of help seeking, of supporting a child with who's experiencing suicidal ideation?
Absolutely. So, I think this applies to parents, but I think this just applies to communities in general, right? I was on a panel a couple days ago where we were talking about, the quote unquote hysteria around the word suicide, around the notion of wanting to take your own life. I distinctly remember from my personal experiences where I have told, trusted adults, medical professionals, other people in my life that I was struggling with my own suicidal ideation, and their immediate response was to call 911, and I ended up in an emergency room for 6 hours in a paper gown. Um, you know, all that did for me was just kind of reinforce this idea that this isn't something I can talk about. this isn't something that I can admit to, and I just need to work through it and just pray that it doesn't get to the point where I'm actually following through on those notions. I think that starts in the home, right? Creating that safety within the home to be able to talk about when you're struggling, to be able to talk about when something is bothering you, and being met with compassion and support and like collective problem solving rather than, ignore it, go away, this isn't something that we deal with. Or even a fear response of like overcorrecting, let's get you immediately to a hospital and, immediately get you checked out and everything, really kind of creating that space where a child or another member of the family can come to you and talk about how they're feeling, and you figure out what the most appropriate next step is together. And I think, another thing that would have, like, I think that would be really powerful would be to see kind of a normalization of the fact that life isn't great all the time. As when I was suffering with my own mental health challenges as a teenager, a lot of the reason that I was afraid of speaking up and asking for help was because I thought that I was going to be hit with like, you know, what do you have to complain about? Like, life is so good for you. When I was growing up, we had it so difficult, kind of talking about what Dr. Bhargave was saying about the generational traumas being more valid than what I was going through. But I recently did a presentation at a high school where a teenage girl came up to me after, and her notion, I think, was more accurate to what I was going through, where I was beating myself up about that, where what do I have to complain about? My parents have given me everything, and my life is so much better than like anyone could have ever imagined. How dare I feel this way? But I did. The fact that it didn't make any sense didn't change the fact that that's how I felt, right? And so kind of creating that dialogue of like, things happen, feelings change. Let's talk about it, let's acknowledge it, and kind of recognize the fact that sometimes they don't make sense, but they still exist and we still need to do something about that. And that starts in the household.
Thank you. And Dr. Jha, I see your hand raised, but we are running a little bit short on time, so I'll circle back to you in just a little bit. I do want to ask as well, when we're thinking about the groups that are the most vulnerable, and maybe I'll direct this to Dr. Bhargave in particular, um, which groups of the South Asian community do you believe to be like most vulnerable, or who do you see the most experiencing these issues with suicidal ideation?
Yeah, I think we start that conversation with saying any one of us could be in a situation, right, where we can experience mental health challenges. But there are a couple of groups, in the interest of time, I'll mention two in particular that come to mind. One is the teens, the young adult and the teen group. I'll tell you, every statistic I've read has said that India has one of the highest rates of youth suicide, and it's one of the leading causes of death in 15 to 29-year-olds in India, as well as here in this country. Men and women in particular, young women in particular, and that oftentimes doesn't even include the rates of suicide attempts as much as it talks about completed suicide. Having said that, what are some risk factors for teen depression and youth depression? Well, having difficult family circumstances is one certain factor. Also, those who have some kind of fragile peer relationships don't have a strong support network. Sometimes that's a factor. We know that those who've experienced bullying are living through difficult poverty conditions. That's another factor, although, again, depression doesn't discriminate by socioeconomic status, of course. Those who have been victims of sexual abuse or domestic violence is another risk factor, along with those who identify with a certain sexual or gender orientation. Interestingly, another risk factor that we see a lot is romantic disappointments. And then finally, among teens, the other one thing I want to mention is coexisting conditions along with depression. So substance use, anxiety conditions, eating disorders. So the teens and young adults is a population that I would want to draw attention to. And the other that I think I want to mention is the members of our LGBTQ community. Again, the disproportionate mental health, social well-being impact on members of that community. We can't emphasize enough, and that includes the rates of suicide. So the risk factors there include the higher discrimination rates, violence that they have been subjected to, the role of guilt perhaps plays another role there. And really, this can't be stressed enough. Pooja was talking about the role of families. We know that those in the LGBTQ community who do not have the support of their family of origin are twice as likely to report suicide attempts. So you can see that within that description and those risk factors I talked about, there's room to talk about many other groups that, just for the interest of time, we didn't get to today. But I think the youth and teen and then the LGBTQ really do pop into my head.
Thank you. And then Dr. Jha, I wanted to go back to you and ask a little bit about mental health challenges for maybe later in life immigrants or older adults, and what kinds of challenges they might be facing.
Right. So Pavitra, in the data that we analyzed, and there is a caveat there that it was just one county worth of data, right? We actually found that middle-aged, the sample, the largest representation was middle-aged men. And if you follow the anecdotal evidence from community papers, there's a lot of incidents of financial sort of catastrophes that are driving men to die by suicide. And there have also been very violent incidents of homicide, suicides, right? So one thing that you had earlier asked the question about cultural traditions, I think the part that sort of bothers me a lot often is that in our culture, across the board almost, suicide is an accepted option for people. And it comes from thousands of years of having a history of suicides as being one way to resolve situational, contextual challenges, okay? So now, even in the United States, the trend is changing. When I first started this work, we were told, don't ever call this as anything other than a mental health problem. Now, more and more, both grassroots movements and researchers are saying, no, it is not always a diagnosable mental health condition. So in our culture, we resolve conflicts many times with suicide as an option. When we bring shame to the family, we think suicide is one way to sort of get rid of the problem completely. So what I'm getting at here is that suicidal thought is irrational thinking. And that is a pattern that needs to be changed, So in terms of vulnerability, I think Dr. Bhargave has actually laid it out very well, that we cannot say this group is really at high risk. The youth have a different sort of trajectory to suicidal thinking, and he outlined it. Middle-aged people could be thinking about suicide as an option for a different set of reasons. So we need to be responsive to every individual that we think and see and note as being distressed about some situations, and give them the support that allows them to sort of bear the tide, let the time pass, because it is an irrational thought process. And these thoughts will be corrected by just time. Time is your only tool, So I would say, as a group that is participating on this panel, we should just walk away with saying, we will look at everybody with our eyes wide open, because any one person may be vulnerable in a certain moment. And the message has to be the same for each one of them.
That's a very, very useful framework, I think, Dr. Jha, like thinking particularly about these unique contexts that could have a trajectory towards suicide, I think also opens our eyes to be able to maybe better identify some of those warning signs as they emerge. So let me ask you as well, you've conducted a lot of research on this topic, and I'm wondering if you could talk a little bit about some of the challenges you may have faced in that process and how we can better address those issues in order to improve support structures in particular.
Absolutely. And I think, going along with the theme today, probably the biggest challenge has been stigma. And I've had some measure of success in trying to sort of get past the stigma. But for everyone here, and we have a number of public health professionals in the audience, I think gathering data, whether it's qualitative or quantitative. So we use the framework of assessments, right? We're assessing individuals, we are assessing communities. Assessment by itself is an intervention. You know, we need to acknowledge that too, that when you're asking the right questions, you're actually suggesting to the individuals that their options are manifold, you know. So for me, that has been the biggest barrier, getting people to come and talk. And I've come across some very good sort of professionals as well that are willing to talk, but there needs to be a shift from treatment to prevention. You know, so early in my career, when I would go to psychiatrists or other doctors and say, can you please join me on a panel? I've actually had people say to me, oh, I wouldn't ever do that. And why not? Well, because of liability concerns, right? So one big message I want to give the professionals here is that there's something called Good Samaritan laws. That with goodwill, if you step up to help the community or help an individual, you're not prone to be, you know, a subject of liability. But I did hear that. The other is, what is the appropriate response in the aftermath of a suicide? You know, at times like that, you have a perfect audience for prevention, but we resort to ritualistic funerals and memorials. And I think that is a binding to cultural traditions that may not work in these situations, you know? And I have intervened in those contexts too, especially for young people, where I was told that no young person will be allowed to come to the funeral by the parents. And yet there were 150 there because it was a large high school. You know, it would have been perfect as an opportunity to train them for resilience. You know, the last barrier is this belief system of stoicism. You know, stoicism is a certain philosophy that we adhere to, which is like, take it on the chin, bite your lip, tighten your belt, pull up the bootstraps, and just move on. And people that are grieving and traumatized, they'll tell you that the only choice they have is to become silent because you cannot move on. You know, and the perception that we are not a caring, compassionate community after all, you know? So those are barriers both to designing programs and doing the research and doing something from a public health perspective.
Thank you. I think you've hit on a number of really important challenges that you've run into. And so from a clinical perspective, Dr. Bhargave, can you tell us a little bit about what effective prevention and treatment could look like?
Sure. You know, I think I should say this too. We've come a long way, and yet we have a ways to go, right? And there are lots of ways in which we can really move forward with this. There's a few things though that come to mind as what I will call pillars for treatment. I think these things are really important in terms of policy as well as the clinical work that many of us are trying to do. The first one is really what we're trying to do here today, which is to dispense reliable and accurate information. That means reliable, accurate information about conditions, mental health conditions, certainly treatment options, but also resources within our community. And that can be an online presence, that can be face-to-face. And obviously it depends on who it is that you're speaking to in that moment. Young children, for example, sometimes respond better to books as a way of introducing a conversation. So dispensing reliable information is one pillar. I would say another one is using appropriate language. I can tell you that within my setting as a child psychiatrist, I've often seen adults who themselves are nervous about what they're speaking to their children about, and the ways in which they talk, either the child just doesn't understand or doesn't relate in some way. So using appropriate language, and for our community in particular, using language that is common to that they can express themselves in is obviously really, really important. When you use appropriate language, you dispel myths, you're able to chip away at stigma, and you're also able to create safe spaces for vulnerable discussion. So that's another pillar of treatment, I would say. And then also really encouraging those in our community to seek others within the community. So certainly culturally sensitive and appropriate types of treatment, but I'm talking about people who are also experiencing perhaps what they've gone through. For Pooja to be here today to share her experience is going to make a difference for someone else who might be in a similar situation as well. It really creates this sense of community and of support. So that's a strength. Taking information and then dispensing it to your extended family, to your places of worship, to school settings. That's another really important part. And then finally, I'll just say, again, what we're doing here or trying to do here is advocacy. Advocacy plays a big role when it comes to what we can do in the real world setting of making a difference, because advocacy, we know, helps to break down stigma. It helps to raise awareness. It also helps to give a sense of solidarity and common purpose. So it's a great question, Pavitra, and it's a complicated one, but I think that those are some things that we have to incorporate if we're going to move forward with this.
Thank you, Dr. Bhargave. I think those are really useful and tangible takeaways. And so, you bring up both policy and community. So Pooja, I want to turn to you next, which is, your work both as a policy person, but then also in your community work. This is kind of a multi-pronged question, so bear with me. But what are some strategies that could lead to better supporting the well-being of the South Asian community, both policy-wise, but also in terms of how can the community better support our well-being?
Yeah, so, in the policy space right now, like mental health is getting more attention than it's ever gotten before. And I think that is remarkable. But a lot of the conversations that we're having around suicide prevention are interventions that happen in that last moment between a mental health crisis and taking action to ending your own life. If you are conditioned to not ask for help when you are struggling with these kinds of things, the fact that you know about crisis resources does not mean that you are going to use them. Awareness around those last step interventions is not going to change the outcome for you because you did not want to ask for help in every step leading up to that. So I think building on what Dr. Bhargave said, the fact that we're having this conversation is absolutely remarkable. And I am tasking every single person who is listening to what I am saying right now to continue to call people in, continue to say the word suicide, continue to talk about mental health, not just in rooms where it is allowed, but in rooms where it might not have ever been said before. Talk about it at your temple, talk about it at the local Udupi cafe, talk about it at whatever weekend trip you're going on with the little chosen family that you have. Because the more you talk about it and the more you quote unquote normalize it, the more it becomes okay for someone to engage in resources both at that moment of crisis and well beyond it. And kind of building on what Dr. Jha said, like a lot of the data that we have is inaccurate because a lot of that data is self-reported. If you do not feel safe talking about this to your community, to your best friends, to the people that you share a household with, why are you going to talk about it to some random researcher from the CDC? Right? And that data is what decides which groups get funding, which groups interventions get allocated to, and what those interventions look like. Right now, our community is being left off the table because we are not a priority because our numbers don't reflect that we have a problem. Meanwhile, I have an entire repository that would single-handedly dispute that, but it doesn't matter. We need to start with the internal community, and that is the job of the people within the community to start that conversation. Some random white person from the AFSP can't come in and say that, hey, you guys should engage in this topic because that just reinforces the idea that it's a white person thing that's being imposed on us. We need to be the ones within our communities to lead that conversation.
Thank you so much, Pooja. I think that was very powerful. So before I ask my next question, which I'm going to really direct at all the panelists, I do want to let our audience members know to please put anything in the chat that you'd like to ask the panelists, and we'll try and ask the panelists in the order in which the questions are received. So I am going to ask each of the panelists, could you each share one actionable step or key takeaway on raising suicide awareness and prevention within the South Asian community before we move to the Q&A? And I'll start with Dr. Jha.
I'm going to pass for a moment. Go to one of the others.
Okay, sure. Could I ask Dr. Bhargave?
Sure. And in the interest of wanting questions, time for that, I'll keep it a little short too. I want to just follow up with what Pooja said. I think the most actionable takeaway is to have a conversation. Whether you are someone who is struggling in this moment, not reaching that crisis point, just struggling with something that's happening in your moment right now, or you're someone who thinks that someone in your circle and in your vicinity might be going through something. I think that's certainly an opportunity to have a conversation, but really conversations around emotional well-being and emotional health should be kitchen table discussions. So just like we talk about other things among family members, whether it's stranger danger or the cyberbullying and the other topics that are so crucial. Emotional health, there is no health without emotional health. So the more we can make it a part of daily conversations, certainly within our community, in a broader way within our places of worship and places of gathering and all that, but right around the table, whether it's with your friends or it's with your family members. And I found that, for example, during the pandemic, it was an interesting opportunity that we had because it was suddenly okay to not be okay because so many of us had a difficult time adjusting or figuring out what's next and how this is going to look. So there are ways to have conversations, but it probably begins with opening that conversation yourself. And that takes a great deal of courage and it takes vulnerability, and those two words go together. But that to me is the biggest takeaway. We need to have more and more conversations, just like we're doing right now.
Pavitra, you're on mute.
Thank you so much. Dr. Jha, would you like to speak next?
Yes, I can now sort of express my thoughts. So the first thing is that if somebody is distressed, look them in the eye and walk up and ask them, how are you? Really, how are you? What's going on, right? And remember that you don't need to be a trained mental health professional to do this. From the cases that we know of, the one that stands out for me the most is this person who said, if even one person had looked at me and smiled, I would not have walked to the bridge and jumped off. So this is a letter that was found in a decedent's pocket. It's a story that was covered by the New York Times. Data and research has shown that social support is the only variable that actually can prevent a suicide. Mm-hmm. The second piece I want to say is, and this is piggybacking on Dr. Bhargave's sort of take on this, spirituality is very helpful to make us healthy. But when you are in a moment of despair and distress, thinking that meditation is going to take you out of it, and I'm saying this because I've actually had families say this to me, it is likely to make you more depressed because you go into a pondering, brooding state of mind. So there are times to resort to religion and spirituality, and there are times to recognize that this is a mental health issue that needs behavioral interventions and behavioral support. So that wasn't one takeaway, that's two.
I think those are two very useful takeaways nonetheless. And then Pooja, can we hear from you as well?
Yeah, I think this was mentioned earlier, but acknowledge the fact that this happens in your communities. When someone dies by suicide, like creating that space for the family to express their grief and grapple with their loss using the resources whatever resources that they might have and might need. And One of the things that I experienced so much in the aftermath of losing Raj, and that I hear so much when people are going through whatever, is their community saying that I didn't reach out because I didn't know what to say. Then reach out and listen. Say, you know, I know that you're going through a tough time. Maybe you can't understand it. Acknowledge that I can't know exactly what you're going through, but I'm here to listen. And then reminding them that the door is open for support, whatever that might look like. A key example, very tangible example, Raj set up my TSA pre-check. The account is linked to his phone number. Every time I try to go, it's expired now, and every time I try to log in, the two-factor authentication gets sent to a phone that I cannot bear to touch.
Mm.
A friend reached out to me and was like, "Hey, I'll be in town this date to this date. Why don't we sit down and I can help you with that?"
Mm.
It's going to be hard, right? But she was like, "I might not know what to say. I might not know what to do, but I know how to give you a PIN code off of a phone."
Mm.
Those things make such a difference. And if you're looking for a catalyst, a little bit of shameless self-promotion, but I am the subject of a documentary that is talking about life after suicide loss and how you can, a lot of the subject matter is focused on like what grief looks like and how people who might not be going through it can go through it. Use that as a catalyst to share your own experience and welcome people into the conversation and build that compassion that, I know is there within our community, but we are just afraid to embrace.
Thank you so much, Pooja. And can you put a link to the documentary as well, if or how folks can find the documentary?
Yeah, it's still in the final production stage, but I can put in the link to our community page where people can learn more about it and get involved and be aware of when it gets released.
Thank you so much. So we're nearing the end of our time, but I do want to first thank the panelists so much for your insights and your vulnerability and your courage in being here today, as well as the audience for the very same, especially those of you who've been able to participate in the chat. We 100% recognize that not everyone is able to. This is a difficult subject, but being here is something still, and we really do appreciate it. Before we conclude, are there any questions for the panelists? And so I see that we do have a question. Go ahead,
Yeah,
Mishra.
yeah. So we do have a question from Vidhi. Is therapy still as stigmatized in the community as much as talking about suicide is? What are the panel's thoughts on this?
Sure, I'll start with that one. Yes, I can tell you that as someone who's in the trenches, as it were, treating mental health conditions in kids, teens, and adults, when I talk about counseling and therapy, um, it is another hurdle to have to sometimes overcome because again, it requires such a commitment to going in, being vulnerable, sharing, and that's something that again, for the reasons that we've talked about today with stigma and other things, is still very, very difficult to do. Or a lot of times they'll say, "Well, I have you. Why do I also need to see a counselor?" And my role is a little different as a psychiatrist. And yet, what I really realize that to mean is I've taken my chance with you, and you've been here with me. Why do I need to do this again? So I think that there is still an issue with that. I can say this, I do think that it is changing, even in the 25 years that I've practiced, just being able to talk to people about the role of counseling. People are more open to it. They're more willing to consider it. I think the youth have a lot to do with that. I have a great deal of optimism about where we're headed in terms of our understanding of emotional well-being, because young people are willing to be to be more open, to use the right vocabulary and all of that. So we're making headway, we're chipping away at it, but there is still the resistance from my experience.
Thank you, Dr. Bhargave. There's another question. I believe dealing with grief is layered, but what would be a primary step or a great way to address it?
So may I respond? Go ahead, Pooja. Go ahead.
Yeah, I think, the most basic thing that I think people can do is just acknowledge that that person lived. I think, Dr. Jha mentioned like it's so easy nowadays. You have a digital calendar anywhere you go. Put in that birthday, put in the date of their passing, and just send a text to that person saying, "Hey, I know today might be a hard day for you," sending a little extra love. Because I think it's so jarring how quickly people fade from our collective memory. But when you're a person who carries that person in your heart, it feels like a part of you no longer gets to exist. And that's just a compounding grief that happens over and over again. So being the person to course correct on that and say, I acknowledge that that person died and I acknowledge that their loss can be painful for you, and I want to be here for you, just even in that acknowledgement.
Right, right.
Thank you, Pooja. We have a question from Subi. She wants to know what are some of the parental resources for suicide awareness?
That requires a very long answer, Shubi. There's tons and tons of books. There's one that was written by a survivor of her son's suicide, who was actually an Atlanta native. Her name is My Son, My Son. Now, do we have books that are written by South Asians per se? I don't believe there's a whole lot there. But if you just search, um, even using a fuzzy term, you'll find something. I'm going to give you the name of a website. The Doogie Center in LA is a center that was established for childhood grief. And they run a lot of suicide support groups for children. So going to their website would be a good way to start. And clearly this is a need that we all have to respond to. I think we should start coming up with a book for South Asian parents, but I don't know of one that's written directly for that.
Thank you, Dr. Jha. And then we'll also share resources in a follow-up email. Just one other question. Amalika wants to know, and this is a question for all panelists, when is the appropriate age to talk to a child about suicide? When are they exposed to the concept of suicide?
Do you want to respond, Suvrat, or can I just speak as well?
Go ahead and start, Arna, and I have a couple of thoughts, but go ahead.
Yeah. So here's the thing. We need to be aware that children are talking about suicide in their schools all the time. And some of the programs that are coming up are in response to school suicides. And it's happening in India and it's happening here as well. And our kids are hearing about it. So it goes back to the idea of the stigma is within our community. Believe me, if parents don't talk about it, children will keep quiet because they're trying to protect you. They believe you cannot handle it. So you can bring it up anytime, even starting with what did you talk about in school today? There is a program called Hope Squad that is being rolled out in a lot of schools. And it's mainly high school based, but now they're going all the way to elementary schools. That may be a nice, innocuous way of starting a conversation to say, do you guys have Hope Squad in your schools? What do they teach you? But if a suicide has happened, and this I've heard from so many experts and so many survivors, don't hide the cause of death just because a child is young. You're not doing them any favor at all. Open it up and use that as a springboard to continue to normalize, like Pooja said, suicidal thinking, because you'll be able to prevent the next one. What I've encountered in working with families is intergenerational transmission of suicide risk. And I do it in the aftermath of suicide deaths every time. And it's amazing that they've had a history in previous generations, not only of attempts, but also of deaths, and never talked about it till they lose this young person to a suicide death. Imagine what would have happened if they'd only opened up that conversation.
Yeah, absolutely. Dr. Bhargave, do you want to?
Yeah, the only thing I'll add to that, I agree with everything that Dr. Jha just said, but also let me just say that much like many important, valuable, profound discussions with our children, It's never going to be the talk. It is going to be a series of talks that you will have repeatedly over time, and it'll be adjusted based on the experiences around them. It'll be adjusted based on the age of your child. It'll be adjusted based on the emotional sensitivity and disposition of your child as well. So begin a conversation, and it starts even with, tell me how you've been feeling with the school gearing up now, 6 weeks into it. How are things? I mean, really, you'll be surprised. It doesn't take much as long as you provide a safe space for children to talk. They do want to talk, and there are kind of pivotal events that may be a obvious opening, including school shootings or someone in the community being lost. Those are certainly opportunities, but begin a discussion somewhere. Do it in a way that is using vocabulary that's appropriate for your child. Be able to share your own places where you can, of where you can relate, demonstrate by example, and then have conversations over and over again.
And just to build on that, make sure that those conversations are rooted in compassion. This is something that happens to real people, that happens to real families. Say their names, say their experiences. And whether it's your child who's struggling or somebody else, always try to embed a way of how can we provide support and care for this person.
Yeah, that is so true. And that sort of answers another question that was asked. Sam asked about what is your advice to help someone who's clearly distressed? How can they feel safe discussing it with you? So I think some of these, the compassion piece is so critical there. I think that's enough. I think we don't have time for more questions. So I guess we'll just close it now. Again, thank you on behalf of SAFA and our audience. Thank you to our panelists for sharing your valuable insights and perspectives today. And I think one clear takeaway is that raising awareness and addressing these challenges, it's really, it requires a multifaceted approach, which involves not only mental health professionals, but family members, community members, policymakers. And so it's really essential that we continue these conversations and work together to basically create this culture where mental health can be openly discussed and supported without the stigma that typically comes with it. Let's continue to break the silence and then foster these supportive environments and really advocate for better mental health outcomes for the South Asian community. So thank you so much, everybody, for joining us. Take care. Thank you.
Thank you, everyone. We have some just ways that you can continue to stay engaged with SAFA in the chat. And then, we will be sending out a recording for this sometime next week, along with the follow-up email with resources that were discussed on this call and any other resources that the speakers have for us. Thank you all.